Yes, good people. I can see it's another day and another day of checking out. Yesterday we had a topic. I answered questions in the evening. Here it was in the evening, and the questions were targeting mostly were targeting autism. The questions were targeting autism. So today we had programmed and said we will do diagnosis of autism, diagnosis of autism. And we said yesterday, we said we should understand where this spectrum starts from. And we saw autism starts from the day conception starts. Many questions were asked yesterday, and today we are going on to continue with what we were dealing with. We will deal with how to find out. Now, you know how to find out means how to know that this is autism, because we saw there are several types of spectrum of diseases like schizophrenia, bipolar, and also all the other spectrums that we saw yesterday. And as I was answering questions, some questions came up, and I at least tried to question. I can see Jamaican uncle is already here. I tried as I can so that I could answer the questions that were there. So autism is a disease that starts from conception, the day that someone conceives and implantation happens. So when someone conceives and implantation happens, that is the day. Greetings, Dr. Benjamin. Yes, welcome, Jamaican uncle. I can see you. Welcome to the platform. So when the disease starts, when you conceive, and we said after conception, there is that day of implantation, blastocyst, when the eggs are being implanted in the uterus. Yes, that is where you start having complications. Migration of ectoderm cells forming something called the neural tube, and then they are displaced. So welcome everyone to the channel. Today is a good day. It's a day that we were waiting for the diagnosis. If you are new in the channel, be free to subscribe and watch a bit, look at what I'm doing, and like the channel too, and ask any question that you have. Pick up yourself. I can see FRC in the chat. Pick up yourself, FRC, wherever you are, so you can subscribe and follow us and interact with the people that are texting, chatting. You know, when you interact is when you know many things. When you interact is when you know many things. So everyone who is in the channel, this is Benjamin the Wise Guy. We deal with issues concerning medical issues. So we had started autism. If you have a question, the chat is open. You can always go to the chat and text there and ask a question. Even a question that you feel is so, just ask any question. We will answer, we will help. We interact and sensitize everyone in this channel. So welcome everyone, welcome new friends. I've just started. Yesterday we were dealing with autism, and we knew what autism is. I said autism starts from, we saw autism starts from the early ages of conception, when the implantation is happening. When the implantation is happening, that is where autism starts. But throughout the carrying of pregnancy, you may not notice. So we diagnose autism after birth. We diagnose autism after birth. That is where we start knowing, oh, so our child has autism, because you cannot know the cells that I think I can go through them. There is some. What do you get there? Where did I put those papers? I was explaining using some pictures here. Like this is the sperm, this is the ova. When they fuse, they form a ball that is called the morula, and then the ball itself, it turns into a mass of cells. A mass of cells is implanted to the uterus. Then after it is implanted, it forms the cells that were formed here. They start to do what? To align themselves. So the cells that are above, this is called the ectoderm. The middle ones are called mesoderm. The down ones are called endoderm. You see? So this is how, when this is implanted here, starts to align. Then these cells, they start going inside. From the top one, it starts going inside, which is called now they are forming. Hello Margie, welcome to the platform. I'm just revising what we did yesterday. When these cells now are like this, they start forming something called the neural tube. Remember, this process is inside the uterus. So inside the uterus, as the cells are going down like this, forming the neural tube, this is where the action starts. So we said what causes autism is when these cells are migrating, the cells are migrating going down to form the neural tube, which will come up with the hand, heart, the brain, the nose, the formation. It is whereby this now starts, when it goes down, starts forming maybe you get genetically, there are some factors like the protein that stimulate and give signals. They are not working in the genetic line. Infections, we saw alcohol, we saw several things we saw yesterday that can make these cells, when they are going down to form the neural tube, to start having problems. So the displacement of these cells when they are implanted is what comes out with autism. And we say it, depending with the degree or percentage of destruction of these cells when they are forming, they are going down, is where you get autism. And now, if the brain is injured, at what capacity were the cells injured? You get? That is where autism comes in. Now, let's deal with diagnosis. The diagnosis of autism. So many things are used to diagnose autism, but we said there is a group of psychologists that came up and sat together, and they came up with something called Diagnostic and Statistical Manual of Mental Disorders. It is called DSM-5. Diagnostic and Statistics Manual it was a group of psychiatrists. So when they sat down, they decided, because this spectrum are big, let's categorize this as autism, this as bipolar, and these characteristics under this investigation as schizophrenia. You see, it's a manual. It's not a book that is written with one person. It is written by American Psychiatric Association. Many psychiatrists sat down and they developed it. So according to DSM-5, there are some things that Diagnostic Statistical Manual of Psychiatry. According to that, ASD, Autism Spectrum of Disease, is a neurodevelopment disorder that is characterized by several characteristics and spectra, like persistent deficit in social communication and interaction. Very important. When we are talking about autism, we should talk about that. Social communication and interaction is very important, because most children that have autism, first, social interaction is a problem. Restrictive repetitive pattern of behaviors, interest, or activity. You get restrictive, repetitive behavior, interest, or activities is not there. Those are two main things that when you talk about autism, you come across: communication and social interaction. You get communication and social interaction, and then patterns of behaviors and activities are not normal. So the most common, the core things that are based when you are diagnosing autism are persistent deficit and communication and interaction, and restricted repetitive pattern of behaviors. Now, according to the manual that people sat down and decided, now this is the manual that we are going to use to diagnose autism. And guys, when you are new, you like and interact. Some people go to a channel but they don't want to interact and they don't want to say that I'm here. You get? They just go to a channel and then they keep silent while watching. So if you are new, my guys, interact, chat, say something. Let us know that you are here and you are watching. Now, according to the diagnosis, it is very simple. When you just say A, B, C, D, and E. And we'll see how these criteria go from A, B, C, D, and E. But the core units, when it comes to these spectrums that people are so interested to watch and listen, I usually go slow. So today, sit down and relax and listen. Put your earphones, walk as you listen, and let's get to know the core units that we have seen that this spectrum is diagnosed with are how many? 2. Social interaction and behavioral changes, interest and activities, how this person behaves and the interest in activities. You get? Those are the most important things that we have. Now, let's go and see. I will say all through, I'll name all of them, and then I come back and we start one by one. Now, listen to this. Let me put this here. Persistent deficit in social communication. You see, that is a core subject. And a persistent deficit in core association, you have self-emotional reciprocity, non-verbal communication deficit, difficult in relationships. Then we have the other one, restrictive repetitive behavior. Then we have symptoms present in the early development. We check about them. And then we have clinical significance and impairment. Clinical, how does it affect daily work? We'll check on it. And then we have not better explained intellectual disability alone. If this child does not have a better explained interactive disability alone, you get? So the diagnostic process goes like that. And then we have screening, we have comprehensive clinical assessment, we have detail in development, behavioral observation. Step 3, standardized diagnostic tools that we use in hospitals, medical and neurological evaluations. Then we check on severity of this child. I'm just going fast on that. And then differential diagnosis. What can be like autism that is confusing us? You get? And we will, before we finish, of course, we'll do the what causes. Now let's start from the persistent deficit in social communication. When diagnosing autism, you should check all of this before you say that this person is autistic. before you say that this person is autistic. You should make sure these are present, and I want us to go step by step, because diagnosis is a very critical thing when it comes to managing a disease. You get? Doreen Small, my friend, has a son with autism. He is 22 years old now. Oh, he has grown with it, and hope he is on therapy. So let's talk about social and emotional reciprocity. What do we mean? What I'm saying is, when you are diagnosing autism, or when you want to know this is actually autism, you should have what I'm going through. 1, social and emotional reciprocity. Under that, you should look at abnormal social approach. When this person is closer to people, he is not reacting the normal way other kids or other people are reacting. Sometimes silent, or sometimes overreactive, or doesn't want to be around people. And then we have reduced sharing of emotional interest. Always alone. Sometimes he may not want to share to people. This is for the older children, whatever this person is undergoing, because when you have something that is undergoing in you, something that is hurting you, you may approach someone, or when you feel someone is something, even if it is children, when they are undergoing something, they tend to cry, or they tend to go to talk to someone. Or if it's not a child who is talking, this child will react by crying or keeping silent. Now, these ones, they don't. You get? Poor back and forth conversation. You cannot give them the normal conversation. So that is about self-emotional reciprocity. Social reciprocity, like giving back to what you are given. When I'm talking to you, you reciprocate by answering. When I'm in the society, we talk and you reciprocate by telling me what is happening. You get? Non-verbal communication deficit, poor eye contact, limited facial expression. When you are diagnosing autism, you should check on this. These things are very important when you are diagnosing autism. Limited facial expression, very important. Difficulty in understanding gestures and body language. You know, there are sometimes you cannot talk to a child. You just express gestures like move, come, you do this, go, that child will go. When you try to do these things, this child does not reciprocate. Come, go, you get? That is non-verbal and communication deficit. Though this, if you are noting down, note that before you diagnose, or before you say this child is autistic or this person is autistic, there are these 3 things that are important. Social reciprocity. We have started by social reciprocating. I'm talking to you, you should answer back. We are around people, when we are conversing, you should tell me what you think, or react in a way that you are understanding what I'm saying. You get? Poor back and forth conversation, reducing sharing of emotions, and abnormal approach. Very important when it comes to autism. The third one is difficult in relations. It is difficult for these children to be with good relationship with other children, because, or even adults, the children does not understand this person, the other group. So this child will tend to withdraw from the other children, or this person will tend to withdraw. You will always find them alone. And sometimes aggressive when they are approached, or they withdraw silently when they are approached. Difficulty in relationships. Difficulty adjusting behaviors to social context. Because when you go to visit some people, even a normal person, if you are used to behaving in a certain way in your place, when you visit some people, you tend to adjust your behavior to a kind like how they are, so that you can blend with the people that you've met. You get? He loved to jump and flip books pages. He jumps and accidentally pulled my chandelier down. He is all over 6 feet. Is over 6 feet tall. You see, difficult in reciprocating. Social communication is a problem. That is what Doreen Paul is trying to tell us. Reduced interest in peers. Always wants to be alone. So when you are diagnosing, or when you want to say that this person is autistic, these are the core things. All must be present. Social, emotional, reciprocating. When people are talking to him, when they are conversing, when they are giving gestures, this child should be knowing this is what I mean. Non-verbal communication deficit. Non-verbal communication deficit. Non-verbal communication deficit. You get? How do we talk about non-verbal communication deficit? Sometimes you may sit somewhere and then I point on a cup. I do this. You know, that person will understand, oh, I need that cup. So that person will pull that cup and bring it to me. These children don't understand that. Sometimes you may tell someone by gesture, go, go, go. That one, in autistic children, they are not there. Hi Queen, welcome to the platform. Today we are talking how to diagnose autism. Difficulty in understanding gestures, that's what I'm saying. Limited facial expression, they are always there. Maybe they are always happy, sometimes always sad. Or poor eye contact. Looking at you like this is a problem. You get? So you must make sure when you're a doctor or someone tells you that your child or someone or your relative or someone is autistic, these are the things that this child should be having or this person should be having. Difficulty in relationships. Handling relationships is a problem. So those are the core. They are the 3 core things that you should look at when you are diagnosing autism. And why do we say that? Because when we come to the DSM, disability statistical book, DSM 5 that we talked about, we see that there are so many spectrum of diseases or complications. Because if you are told that this is a disease, you know how it's a complication rather a disease. You get? There are some many things that share the same kind, like the same spectrum, that share the same characters that people bring out. You get? There are so many things that share the same characters that people put out, and categorizing them needs small details to show that this is not schizophrenia, this is not bipolar, this is this one, and this is what we are going through. So when these people sat down and they saw that we have schizophrenia, we have bipolar, we have, sometimes a person can have depression. We call it major depressive disorder. And then it makes you feel that this person has come to get the complication like autism because of brain injury at times. So these are the core values that they picked out and says, if this person does not have this, that one is not bipolar, it's not autism. Social, emotional, reciprocating, non-verbal communication deficit, and what? Difficulty in relationships. Those are 3. But now we go and see there are some that are here: restrictive, repetitive behaviors. These ones, they require, for what I will go through, they require at least more or two from the ones that we have said. Maybe this person has the core ones are social, reciprocating. One of my grandson and also had problem too, but he's very smart in school. He even repeats ABCD backward without anyone teacher. Yes, Jamaican uncle, this is a question that I said I'll answer today. Someone asked yesterday, and even some emails are asking, why are some of the children that are autistic so bright? Their IQ is so high. I will answer that before the end of the session. I tried to answer it yesterday, but I did not answer it fully. Now, we have difficulty in relationships and restrictive, repetitive behavior. Now, from the three that I've named, difficulty in relationships, non-verbal communication deficit, and social emotional reciprocating, you should have at least more than two or two of the following. More than two or two of the following. And listen, repetitive movements, hand flapping and rocking, sometimes flapping and rocking. You get? That is one. In instance of sameness, it is called rigid routine. Rigid routine. Some routines that this person does that are sameness, that are same. You get? You may find that this person likes, which one can I use now? You may find someone always likes doing this. You get? Sameness. Some repetitive routine that are rigid. You get? Or highly restrictive, fixated interest. This person has interest in something that the person likes doing every time. Every time you'll find the person doing that thing. Every time you'll find the person doing it every time. Hyper or hyperreactivity to sensory output. You get? My nephew also has autism and has a master's degree. Yes, we will know why these children, some of them are intellects. And you see here we are saying hyper or hyporeactivity to sensory inputs. So when it comes to hyper or hypoactivities to sensory inputs, what do we mean? What do we mean? Sensory inputs means sometimes you will see someone is reacting in a way when you ask something, this person reacts hyperreactivity. Or sometimes when you ask something, it'll take time before answering. Sensory. Sometimes when this person is at a very hot, when you are subjected to a very hot place, you have to withdraw. But these people don't. Sometimes they take time before they withdraw. Sometimes you will find a person is very cool, shivering, maybe is outside being rained on. But you will find that it takes time before that person moves away from. So a person shivers, and then you find this person and you tell this person, hey, it is raining, can you come out of where you are? You see? This is how it is. Sensitive to noise, pain, and textures. Sometimes when this person is a place that noise is, he reacts so aggressively, or can be the opposite. So it can be either from the three we had, the three: social, emotional, and reciprocating to the social environment, non-verbal deficit, and difficulty in having relationships. You may have like 2 or more of these repetitive movements, instance of sameness, rigid routines, highly restricted fixed interest on something, or hyper or hypo sensitive to sensory inputs like noise, texture, pain. You get? Dr. Ben, I think you are a psychologist. Cut everything you said is 100% true. Oh, uncle. I think when I'm yes, it's Joy. Welcome to the platform. We are talking about how to diagnose autism. How to diagnose autism. Yes, uncle. And even uncle is attesting what I'm saying may be 100% true. You see, so this is, you may have this person having close to this, 2 or close to this, and then you go to the other part. Symptoms present in early developmental period, before the age of 3 years, because we said when this person is in the womb, the brain starts to develop. So when the brain has developed and this person is out to the world, the mother has given birth to this person, what happens now? You start noticing, because the brain is injured, you start noticing the problems, because you know the brain is what does what? The brain is what does everything. Everything that we do is the brain. And I want to repeat something that I think it is important we repeat and we repeat until we get it. You see, autism spectrum is the injury of the brain from that day of conception. So the brain, for you to innovate, for you to feel warmth, for you to smile, for you to swallow, for you to see, for you to smell, there are those nerves that are called the cranial nerves. Yes, I agree, the brain does a lot in human. Yes, there are those nerves that come out of the brain. And when those nerves that come out of the brain, they help us to smell, to see, to swallow, to smile. You get? There are 12. And I said there are 12. Without them, depending on where you are damaged, that is where you bring the complication. You get? Listen to me carefully on this, because some people may say, why is my son autistic and is not behaving like yours? This is why. When the neural tube is formed, the cells are going down to form the brain. You get? What happens? It depends on where the injury happened. If it is in front here, you will not smell, because we start by the first cranial nerve. They are called cranial nerves. So where the cranial nerve comes from, going to the nose, you will not have the sensation of smelling. Remember, they are called olfactory, optic, eye, olfactory, optic, oculomotor, trigeminal. So these 3, they help the eye. You get? No, these 2, they help the eye. Olfactory for the nose, oculomotor, optic, eye vision, eye movement. Trigeminal, they help eating. Trigeminal comes here, it comes from the brain, comes here and divides into 3. One goes to the mandible, it helps you to eat. The other one comes here around the face, it helps you to smile. You get? The other one goes to the eye, ophthalmic. You get? So you are saying olfactory, optic, olfactory for the nose, optic, oculomotor, eyes, trigemina, eating, facial expression, and then eye, and then abducens. Abducens. That one is for facial expression again, muscles. You get? Ophthalmic, optic, oculomotor, trigemina, abducens. We have the other one, which is called, let me get, there is a message that is coming here. Just a minute as we go. I want people to understand why children behave differently from the other. You see, so depending on where the injury is from the day of conception, this is where we have a problem. Now, if we go to abducens, which is the, I'm still telling people, which helps the eyes. You see, from trochlea, we have olfactory, optic, oculomotor. Optic is for vision. Oculomotor is for muscle movement. You get? And then we go to the other, which is called trigemina. Trigemina. You get? Trigemina, the fifth. That one we have said eating and again chewing and facial expression. And then we have another one, facial nerve. Now, facial nerve comes here down to something called conda tympani. Good morning, Dr. Ben and everyone here on live. Welcome everyone. If you are a new person, please hit the like button. And it divides itself, helps test. When you test something and you feel it is sweet, that cranial nerve that has come from the brain has come up to the tongue is the one which helps you. You get? It is the one which helps you. You get? And tear production. You see, facial, when it comes to tear production. So when it comes to that one, when you injure, your brain is injured, and you see someone has some kind like this side has gone like this. It's called Bell's palsy. You will know that nerve is the one which is injured. Number 8, vestibulocochlear, hearing and balance. Remember, I've said they are coming from the brain. Number 8, hearing and balance. You have seen some autistic children, they don't walk well, they walk while they are like this. Why? Because the place of the brain that was affected, it is affecting the vestibulocochlear, the cranial nerve number 8. You get? The vestibulocochlear. You see? So these are the things that we look at, and we differentiate autistic children or adults from other people. Glossopharyngeal, number 9. Swallowing. Number 9, swallowing, glossopharyngeal. If it comes from the and comes here, and at that, the other one that we said, facial innervates states at the 2/3 from here to down 2/3. So glossopharyngeal helps from the other third and swallowing. So those are the things. And you remember vagus nerve that we talked when we were talking about the heart. Mixed. That one innervates the heart, goes to the stomach. It does so many things. Hypoglossal, tongue movement, number 12. So those are those 12 nerves that I've said. They come from the brain, and they go and innervate everything, hearing, balance, everything, swallowing. So when it comes to diagnosis, according to where the neural cells, these cells, it starts the ball when it is implanted, and then it starts to go down as this. So when it starts to go down, this cell starts to migrate inside so that they can form a tube. which is called the neural tube, what happens is where the differentiation starts for forming the brain, the spinal cord. So this one comes in and starts to form the brain, the spinal cord, and everything. But if it is injured, something may happen to the brain. So that is how we start to diagnose these things. So for an autistic child, you may get that some children are not behaving like other children. But we have said the core things that this child must have is emotional reciprocating to others, abnormal social approach, and so non-verbal and difficult in relationship. But you should have at least 2 or more of repetitive movements, highly restrictive interest, and hyper or hyperreactivity. You get? Now, let's deal about this. Symptoms present in early developmental age. Let's deal with some symptoms. May be clear or social demand increases, usually before age 3. Mostly you will get them before age 3. You get? Welcome everyone in the platform. Judy, I see you today. I was in your live, but I could not even chat. I was committed somewhere. It's Chua is here, Efasi is here, Alimig is here, Hyacinth Williams, I saw your text, thank you so much, and I reciprocated, and I usually reciprocate if you text, so I reciprocated Hyacinth William, and I can see Uncle here, Jamaican Uncle, our Emperor, Majay, all it's Chua, everyone that is here, be blessed. Thanks for listening and watching. You can help someone. So there are some things like how can we now get to step-by-step diagnosis? You have seen, even you now you can. Outstanding information, Dr. Benjamin. Thanks a lot, Queen. Thanks a lot. Thanks for your outstanding remarks. Outstanding remarks. Thanks a lot. Thanks for your outstanding remarks. Now, let's deal with important step-by-step. Let's deal with important step-by-step categories of these problems. Let's deal with step-by-step categories of these problems. Step 1, screening. How do we screen? There is something called the M-chart or F-chart, checklist for autism in toddlers, and they use the same criteria that I've told you about. The same criteria. You take the 3 social, emotional, listen, the criteria of diagnosis. If you are coming in right now, it's Dr. Ben. We are going through autism and how to diagnose autism. So if you have not liked, please give your like and ask a question. I always answer every question. So we will see this step-by-step M-chart for autism diagnosis. We have different categories. We have according to ages. When you are going to take the child to the clinic and then the nurse tells you go and visit a psychiatrist because I'm seeing your child has use this. It diagnoses between 18 to 24 months. And what I repeat about that because it's so important, they look at social, emotional reciprocating, non-verbal communication deficit, and difficult in relationships. And on social emotional reciprocating, I mean abnormal social approach, reduced sharing of emotion and interest, reduced sharing of emotions or interest, poor back and forth conversations, non-verbal communication deficits. This person has non-verbal communication deficits. No eye contact. They usually follow the 3 core things I've said, plus the restrictive repetitive behaviors, 2 or more than 2. And under restrictive and repetitive behaviors, they check on repetitive movements, instant of seamless, rigid routines, and highly reactive, fixed interest. I can see Layla is here. Hi Layla, welcome. Hyper or hypersensitivity on noise, pain, and textures. 2 of at least those. These criteria follow that. That's why it is very hard to diagnose an autistic child before this child is born, because you will not know these things, you will not understand. But I said another thing is you can take measures when the child is not born. How? If you have a genetic problem from the things that we saw, what brings autism, from what we saw, what you can do is you can start precautions early, like taking folic acid, visiting antenatal clinic, avoiding alcohol, you get, so that avoiding exposure from other chemicals that can injure you. Those are things you can start to do early. So very important, should a doctor give an autistic child medication to concentrate or focus? Yes, there are medications that can be given to reduce hyperactivities or increase hyperactivity according to the staging or grading of the autism. Moderate, severe, or mild, 1 to 3. So a doctor can give, because it depends with what is affected and what is coming. Because if someone is hyper, it means some neurons are producing more neurotransmitters, so we should reduce them, because if serotonin is at high level in the brain, we should reduce it to reduce the hyperactivity. You get? I'm answering Alimig's question, which I've said, should a doctor give an autistic child medication to concentrate or focus? Very true, you can. Now, diagnosis. The first step is screening using the chart. The chart has those things that I've said. So, tick says this child has autism. But we have to go to the next step. What is the next step? The next step is pediatric neurologist, child psychiatrist, and clinical psychologist. Number 2, after the first person has seen that this child has social emotional reciprocating, poor reciprocating, non-verbal communication deficit, and difficulty in relationship. But also besides those core things, this child has highly restrictive fixed interest or insistence on sameness or on same thing, rigidity, doing the same thing at the same time, or repetitive movement of hands, you get, or hypersensitivity. When this child, and I've used an instance of a child who is, it's raining, and this child cannot come out of the rain and is totally shivering, or this adult who is 16. That is hypersensitivity. Very important. Now, if there is 2 of these or more, we say yes, this one has the criteria of being told is like that. Now we go to comprehensive and clinical assessment. We have said he'll be taken to a neurologist, a child psychiatrist, and clinical psychologist. And it includes what? Speech delay. Because now, if there is speech delay, it means the glossopharyngeal nerve that moves the tongue maybe has a problem. The cells that were destroyed during conception and the neural tube forming on the 14th day of conception, it affected that place. You see? So, play patterns, milestones, delay in milestones, walking, bringing up speech. You know, my children milestones we look at which day do this child start walking, crawling, at which day do this child start walking while holding on things, at which day do this child start saying the first word. Many children start saying mom. I don't know why they don't start saying daddy. Most of the children will always say mama, mama, mama. At which day do they start saying that? Milestones. And then you will check out behavioral observation, behaviors of this child. Eye contact. You get interaction style. How does this child interact with others? How does this child repeat the same things that he's doing? This child can take a spoon when you are at the table, and then you are just is hitting the same place, or hitting things the same thing. You know, it's not because this child wants to do that. Some people may shout always repetitively, telling this child, stop! I'm tired of you doing this. That one is involuntary. Some things that autistic children do are not voluntary. They are involuntary, because when the signal comes from the head telling this child, even you sometimes as an adult, you can take a spoon and hit and then you leave and return. But when the signal comes from the head of this child and this signal is telling hit and return, the signal rebounds and this child continue hitting, because it rebounces back to say return. This child has hit like 10-20 times, then he will not even return. Before returning, he will throw it away. So when you have an autistic child, you should know, even if you shout, some things are not voluntary. This child is not doing those things because the child wants. They become irritative because this child is doing them several times. And the several time of doing those things is because the signaling pathway of the brain is impaired and it is giving several signals. So if you are living with an autistic person, or a person, your child is autistic, now you should understand it is involuntary, something that they don't want, but it comes. And that's why when you will see, if this person has been on therapy, some children, when you shout, the older ones, after doing something, creating noise, you will see them separating themselves and feeling sad. You get? And feeling sad. Why? Because I'm giving an example. I took the spoon. I only wanted to hit once, feel the noise, or I was hitting something and return. But now on the process of hitting, the signal is rebounding and it is involuntary, telling me to hit several times, and I cannot stop because my brain is fixed. And you know, we go by the nerve and then voluntary movement. So when I'm hitting and hitting and hitting, what happens to my brain? When I want to return, the signal is rebounding, so I throw it away. To me, who is autistic, it is a normal thing. I wanted to do only once, but it has come repeatedly. So what do? Someone is shouting at me and I didn't see it was a problem. So it starts bringing to this child or this person that you don't love them because you repeatedly do things that you also do. Yes, Cha, welcome to the child. We are diagnosing shared travels. We are diagnosing autism. You get? Okay, nice. You will share with me after the appointment. We'll talk shared travels. No worries. That is a very important point. Nene and mom, hi. You understand? The repetitive behavior is not because this child wants. And if you have ever been close to a child who is autistic, he'll tell you that. Sometimes you may share to this child, and then after some time, the child feels sad and cries or goes and calms down and be like he's traumatized after aggressively reacting, or you get. So repetitive behaviors are brought by rebound signals from the brain that are telling this. Some kids are very sensitive to loud noise and they cover their ears. Yes, you shout at them and they will do this. You get? So these are things now we are learning, and you see these things are coming out and coming out clearly as per how these children behave. Repetitive behavior. Now let's go to standardized tool. You know, autism diagnosis or observation schedule is another tool that we use. Autism diagnostic and observation tool. Structured interaction test. We use it in the hospital, and we can give the mother to watch and tick and come back with it with some questions the next visit. The caregiver or the mother ticks them, and then you come them with the next visit. Now, when it comes to medical and neurological examination, we have hearing test to rule out other causes, because I've said the brain is affected. What should we do? We should check other things that are affecting this child that may bring something that is not autistic, that is bringing this character of this child as autistic. You get that? Hearing test, excluding deafness. Remember we had the cranial nerve that we said vestibulocochlear. You get? Vestibulocochlear was number 8. So if the brain is damaged around that nerve, you may be deaf and the balance may not be okay. Vision assessment. Check on the cranial nerve. When I'm saying cranial nerve, I'm meaning nerves from the brain. Olfactory. Check when we come to vision assessment, we check at vision. Doctor, I'm asking, when the children take medication for do you think the child will start moving extra slow or even get retracted after a while? No, you cannot. We give drugs per milligrams and per what the child is supposed to get. May I ask, what is the topic, Dr. Ben? Or the topic is, how can you diagnose a child who is autistic? How can you diagnose a child who is autistic? Because Asha Travels has asked about what is the topic, because there are so many things that come and look like autism, but they are not autism, like bipolar and other things. Get? Now, we have to do vision tests, because we have said after olfactory, the smelling test, we have olfactory, optic, oculomotor, we go to trochlea, you get, which checks on the eye muscles, optic for the eye muscles, and then we have optic, oculomotor, and trochlea. Oculomotor and trochlea, they innervate the eye muscles. And also one that is called abducens. Abducens, you get? Cranial nerve number 6, abducens. So those ones, number 6, cranial nerve number 2, 3, and 6, So 6 and 2 for the eye movement muscles, but optic is for viewing. So we check them to rule out that this child has no problem with this brain damage that is bringing all these things. We check that out. So if you have a question, ask. Please don't be confused along the way. I may repeat even 10 times as long as someone understands. So we rule out everything like that. We do EEG to check out if the brain has problems. Maybe this person has a problem of seizures. Brain imaging to check if there is brain damage. It's not in the normal brain. Genetic testing, like fragile syndromes, we check them. So the main reason of checking these things at step 4 is to do what? Is to make sure there is no any other thing that is making this child. And you know, when I was talking about the injury to these cells, it is minute injury, meaning the cells there, they have migrated, the brain has formed, but very small thing is making this child to be autistic. So it may not be macro, it is micro. It may not be big, but there are some things that may be like autistic, but they have brain physical damage. And that's why we do all these hearing tests, vision test, genetic testing, brain imaging to check if there is any damage. You get? Why do we check? To check, we assess the nerves, the cranial nerves, the nerves that arise from the brain. After that, number 4, we have excluded everything. Remember, number 3, we gave a mother or a caregiver some sheets to tick, and when you are seeing he's withdrawing from the children, you tick. When you are seeing there is rain and is not moving, he's just seated, you tick. You go back to sensory, you bring them back, but as we will assess rule out other things that affect the brain. Now let's check about the severity. I'm here listening and getting my autistic son ready for afternoon classes. Welcome, Johnny Be Good. Welcome. I wish you could, Johnny Be Good, check on the what we were talking about yesterday's topic. It will be so important and helpful. If you start from watching from yesterday's topic, Johnny Be Good, it will be so helpful. Welcome to the channel. If you are a new person to the channel, we do medical advice, we interact here, we socialize, and we keep ourselves mentally busy at par to make us healthy. So this is interaction of medical conversations. So if you are new, please hit the like button. Don't forget to subscribe so that you can get our clips right on time. You get? So severity, how is it severe? That is now number 4. And I've been listening for a while now, Dr. Ben. Yes. Thank you so much, Donny Be Good. Yesterday I missed you. I really wanted you to be here, but it's okay. I know you are. We are always busy, and it's good. It's good that you've come today. Thanks a lot. Now we have levels of needing support. The 3 levels that we talked about, you remember? Now that is number 4. Remember, we started by the cause things, and then we started by at least 2. We gave a chart to the parents, and now the doctor is excluding everything that can be having a problem, and now we are at severity. Level 1, where the child requires support. The child now requires support, but it's not really big support like a person who is totally disabled. You get? It's not just that big support like a person who is totally disabled, but this child needs support. Welcome, Betty. I can see you You are in the chat house. Welcome so much. Mild difficult with social interactions. Level 1. Stan's Kitchen. Welcome to the chat. Welcome to the chat. I see you there. I'm so humbled to have all of you here. So level 1 requires support. Mild, I give you 2 thumbs up, Dr. Benj. I give you 1 here. You don't Johnny be good. I give you 1 here. Now, remember we have a question that is pending before we finish. There is a question that has been asked. Why are these children so bright sometimes? We will answer that question. I've not forgot. Why are these children so bright? So mild difficult with social interaction. Mild. This child, you may put this child on normal schools and the child interacts well, but sometimes have a problem. This is a child that can go to normal school, and when you are monitoring, the child can learn there so well. You get? Can function independently but struggle socially. Can function independently but struggles socially. Can function independently but struggles socially. This is level 1. Let's go to level 2. If you have a question, guys, don't fail to answer. I have 1 question. Why are these children so bright? And we will answer it, all of us. So if you have another question that you think it's important, please bring that question to the platform. Please. If you are coming in now and you are new to the platform, here we talk about medical issues. We discuss mental health issues. And we help each other to grow, as we say. Level 2. Don't fail to hit the like button. Level 2. This person requires substantial support. Clear communication deficiencies, repetitive behaviors more noticeable. Repetitive behaviors. You know, we have talked about these behaviors and clear communication deficiency. You may not talk directly to this person, and this person may not reciprocate well. And you remember to the 3 core, the first one was social reciprocating. The first one was social reciprocating. So at my moderate, he may not reciprocate well, and even verbally, non-verbal gestures, he has poor eye contact, may not understand some gestures that you're giving. And then we have level 3. Why, when the child takes the medication, he goes so silent? Some of them go so silent, but some of them just calms down and be normal. It depends with the level of autism that you are in. Depends with the level of autism that you are in. You get? It depends with the level of autism that you are in. The child I know is nonverbal. The parents say he will not only talk to few people. Yes, that one is a level 2. Level 2. If the child can talk to few people but is always calm, that one is level 2. So level 2, when you give these children drugs, they will go silent. Because he can talk, but now you are depreciating the communicating part of the brain a bit, so the child goes silent. Let's go to level 3. Let's go to level 3. Level 3, severe impairment, minimal verbal communication, and significant function liability. It means the kind of damage during conception was high, and it damaged several nerves. Can the medication be too strong? Okay, Alimik, let me talk about medication before I go the next step. when we are giving medication, a good doctor who knows what he or she is doing will not talk about a strong medication. This is how drugs are given. When you tell a doctor, please give this person a very strong sedative, there are some things we check. We don't see a drug as strong. We see a drug by its strength. In this way, like the brain capacity of normal a child, we balance removing. This is for psychologists now and psychiatrists. The brain can remove 200 microunits. This is an example of serotonin or adrenaline that will make this person be very aggressive. But when I give a counteractor, non-serotonin, NS, they are called NSRS antidepressants, they will stop. Onik, welcome to the platform. They will stop up about the brain cells to release more serotonin. So they will stop like 100. So it will be like 150 or no, like 90 or 80, which the body needs. We are not talking about strong, no. We are talking about the strength. Give a person an antibiotic. You check, antibiotics are so many. We have like more than 16 classes of antibiotics. Then you give a person an antibiotic, a malaria antibiotic. We check weight plus severity. So we know this one can take maybe a tenether, this milligrams. So there are so many things that doctors look before you give someone a drug. Before you give someone a drug, there are so many things that you look at. You see? So when I talk of strong, we don't talk like we take drugs and then we give without dosage. No. For a child, they have their dosage. Even for convulsive disorders, we have to look for the dosage. So a doctor who knows what he's doing will never just give medication. He will check on the kind of drug and the milligrams and the effect of that drug in the body, plus what it is counteracting. You get? Even the normal painkillers for adults, people say give paracetamol this 1 gram. We know by the time it is in the body, it will be these milligrams, and the prostaglandins that are being removed from the brain to the blood are this. So it will counteract this, and the liver will take care of this part, and the kidney will take care of this part. So it will not be injured. There are so many things that we look at when it comes to prescription of drugs, mostly when it comes to antidepressants and antipsychotics. I hope my point there has been taken, Alimik. It is very important because the point of saying a strong antibiotic, the point of saying I'm good, Onik, welcome to the chat, and all new people that are here, if you are listening, please hit the like button and subscribe. All new people that are getting in listening. Onik, thank you so much for always being there. We are talking about autism. So Aliming, I think that point has I've tried to explain about giving medication and how to balance them. Now let's go to something else that is very important, which is differential diagnosis. When you go to a hospital with a kid, and then a psychiatrist or the doctor looks at this child, this doctor looks at all the complications that can be sharing the same issue that you have with your child, all of them. And now we are talking about autism. So when we are talking about autism, the doctor will look at ADHD. You know, you may confuse autism with attention deficit hyperactive disorder, intellectual disability, inability to learn and grab things in school or do some things normally when you are taught at home. That is a disorder of the brain. Social communication disorder, interaction publicly with others, hearing loss, and selective mutism. Selective mutism. You get? So, sorry about that. Let me sip something. I'm explaining so slowly so that you can understand. Selective mutism, I know someone may ask, Doc, what is selective mutism? It is onset anxiety disorder at childhood where a person who cannot speak in comfortable settings becomes unable to speak in social situation. You are around the people and you are afraid to say something. You get? That is called selective mutism. So these are disorders that are like autism, and a doctor may confuse selective mutism with autism. You get? So you write them all down, and then now you go to your kicking out by the three things that we named plus the other. Early signs suggesting autism. This is very important again. Early signs suggesting autism. By 12 months, no babbling. The child does not babble. No pointing or gestures. 12 months, a child when it's growing, it starts babbling, doing hands. At 18 months, no single word. Even mama, no single word. No limited eye contact. Some child, even at an age of 3 months, you will see that child knows the mother, knows the father, and knows strangers. These ones do not. At 24 months, no 2 words or phrases, just quiet. Loss of previously acquired skills like regression, they don't. You get? That is how you start knowing this child of mine has a problem. But remember, we have said, or is there anyone has a point before we go to the next? Anyone? I think we understand how autism comes, and now we are diagnosing autism. And we have said that the 3 important things when we come to diagnosing autism. Anyone who has a question, the 3 important points when it comes to diagnosing autism is social reciprocation, non-verbal communication deficit. Non-verbal, we mean gestures. Difficult in relationships. Today will be my dad's 86th birthday. Rest well, daddy. Johnny me good, no worries. May he rest in peace. God knows why. And then we have, after the 3 that I've said, I'm just repeating: social reciprocative, non-verbal communications, and difficulty in relationships. You should have at least 2 or more of repetitive movement, instance of sameness and rigidity. The one I've said, he can be hitting. He likes rigidity, hitting someone. Routine. High restrictive, fixed interest in some things. Hyper or hypoactivities to sensory input. At least 2. So who has a question? I've been talking for like 1 hour. And I want now someone to say something. Someone to say at least a thing. Someone to tell me something. At least one thing. At least one thing. Before I go to, I've gone up to other things that may look like autism. Those are called differential diagnosis. Differential. I know some people right now are answering themselves some questions that they have been asking themselves. Mostly the people that you have not been brought up in a family with an autistic child, but you meet one day and you start associating. So when we talk like this, you are answering your questions. You are answering your questions, you get. And we have said autistic children, let's not be so aggressive when we are dealing with them. Let's not lose our temper when we are dealing with them. Let's not lose our tempers when we are dealing with them. Now, causes of autism, you have said, are totally, mostly, strongly are genetic, neural migration, and then the cells when they are migrating, the ectoderm, when they are migrating, it becomes a problem. You get abnormal brain development and environmental influences may interrupt the brain. So, yes, emphasis true. You need to be very patient. Because if you are not patient, you may lose your child. I want everyone to know and to understand clearly what I'm going to say. And these are things that we have talked about from the beginning of diagnosis. No one have heard me saying we do a blood test. The other thing is, I've said we do brain scan to exclude any damage of the brain. I've not said there is a scan that diagnoses and tells us this child is autistic. No blood test or any scan. The scans that we do is to just be sure there is no physical head damage. You get? Thanks everyone. His name will live. Yeah, he left 13 children. Welcome, Johnny. Be good. Welcome. We've seen. Be grateful. Diagnosis of autism is totally behavioral and developmental. Early diagnosis improves outcome because of drugs and some therapies, cognitive therapies, psychotherapies. Lifelong condition but functional can improve with support. But you should refer to a specialist when speech delays come in, poor social interactions, and repetitive behaviors or parental concern. You get? That is the time we should see a specialist. Anyone with a question today? Anyone with a question? Johnny, be good. Let me highlight some things here before I continue. Johnny, be good. Sorry for the loss, but there is hope for our dead loved ones. Take heart, accept our love. As Team Jamaican Uncle. Johnny, be good. You got that from Hyacinth Williams. Thanks again, everyone, for birthday wishes from my dad. Welcome, Johnny, be good. And FRC, happy birthday, Dad, rest well. That is from Alimig. You need to be patient. That was a reaction from FRC. Onik, good. Everyone, good day. and don't forget to like the stream. Okay, and then we have Betty in the house giving loves, Betty in the house giving loves, and we have Quincy NLB. This child I know is novable. The parents say he will only talk to a few people, and they say that is moderate. And we have the child is known. We have someone here. Sha travels. Sha travels right now is always. She's always at work. At work, always be blessed. Betty, be blessed. I can see some people. Jamaican uncle, I know you are listening calmly, even if you are busy. I know you are here listening. Now, there are some things that there's something that Jamaican uncle asked, and that is what will be the end of the topic today. If you have any question, you can ask, and then tomorrow we'll do another topic. We will see how to differentiate between autism and other spectrum like bipolar and others. So we will start and again after autism, bipolar, but we'll see how to differentiate. Now, some autistic children are so bright, very high IQ and exceptional abilities because of how their brain processes information. Yes? This is not true for all children with autism. I've said so from the starting. It is not true to all children with autism, but some. I've said there is something called neurodiversity. Neurodiversity meaning how the signaling of the brain works. That was a question from Jamaican uncle. Why are they so smart? Autistics' brains are organized differently. Often show enhanced local processing. They focus on very small details because when you are injured, the power comes on, and when some part, like when someone is injured this hand and it's not powerful, you'll find the right hand is so powerful, or when the right hand is injured, you'll find the left one is so powerful. And that is how the brain cells are. When part of it is injured in microcells, you'll find the other part is trying to compensate. So where there is intellectual capability, if it was not injured, because your head, your brain has a place for intellectual capability. So if it was not hurt and there is somewhere that was hurt, this other place compensates. May have strong connection in certain brain regions linked to memory or perception. So it compensates with the other parts that has been hurt. This can lead to superior pattern recognition, strong analytic thinking. Go and watch the movie called The Good Doctor. Follow The Good Doctor, you will see. The guy that acted Bates Motel. And now, Jamaican uncle is telling us they have one of them that can say A, B, C, D, F up to Z and starts from Z again backwards up to A. And you see here we are saying they have strong connection in certain brain region linking to memory or perception. Superior patterns of recognition of some things and strong analytic thinking, because if your part of the brain that is for intellectual thinking and capacity was not damaged, it will try to compensate from the other side that has a problem. You understand? Exemption attention details. Autistic children notice teeny difference others miss. Excels. If a child who is autistic likes painting, this child will paint a picture that will be like a real picture because of the minute detailing that this child, the brain is focusing on. Get? He loves reading so because he can memorize what he reads and remember things from he was a baby. Some people named and even, but don't like lighting. Yes, because of sensitivity. Marjay has said one of the cousins has a master's. You see now. Strong memory system, exemptional role memory, facts, numbers, and details. Because of the brain compensating from the injury. But there are some that the brain is injured at the levels of intellectual, they may not have this. So it depends with some. Intense focus. These children have intense focus. Servant ability. Music, mathematics, memory, and art. And even cognitive profile. You get very strong abilities in some areas. So you now know why. If Marjay is still in the house, Marjay, if you are still here, you now know why they are so bright. And that is the question that will end up the day. Anyone with any question? It has been 1.5 hours of interaction, and I think some people have answered themselves the questions that they have been asking for so long. And you know, when you answer yourself, you feel better. So anyone with a question I can answer? Anyone with a question I can answer? But I'll be answering some of the questions that are coming at my email. Of course, at 9. We will not have, today is on Tuesday. Tomorrow is when we have Feel Good Friday. So I may not answer. We will do Feel Good evening tomorrow. So if anyone has a question, my friends, if anyone has a question, you may ask. And we see what next at 9. We'll meet at 9 again. If you have at 6, 7, 8, 9. At 9, according to your time, it's 2 hours from now. There are some questions that come to the email that I usually answer that time. If you are around, you can stay around, and then we interact, we see the way forward. So if no question, those that will meet at 9, welcome. Thank you everyone for being here. Thank you, Jamaican Uncle Marjay. Marjay, there was something that you were to tell me, but I know at 9 you will tell me. Or it was the master's one, okay? And all that have been here. Thank you so much. Be blessed, everyone. Let's meet at 9. Bye. Before I go, Alimig, you need to see a doctor first before doing that. But I'll talk about it at 9. So if you'll have a time, please check out. Check me out at 9. I'll talk about medication and autism, where to stop and when not to stop. That question I'll answer it at 9, 2 hours from now. Let me do some things, then we will talk.